What is Lesch-Nyhan Syndrome? Lesch-Nyhan Syndrome is a rare inherited disorder caused by a deficiency of the enzyme hypoxanthine-guanine phosphoribosyltransferase. Lesch-Nyhan Syndrome is characterized by three major hallmarks: neurologic dysfunction, cognitive and behavioral disturbances including self-mutilation, and uric acid overproduction hyperuricemia. Damage to the basal ganglia causes affected individuals to adopt a characteristic fencing stance due to the nature of the lesion. Some may also have macrocytic anemia due to the faulty DNA synthesis. Virtually all patients are male. Males experience delayed growth in puberty, and most develop shrunken testicles or testicular atrophy. Female carriers are at an increased risk for gouty arthritis, but are usually otherwise unaffected. A 6-month-old boy is brought to the office by his mother due to concern that he is not developing normally. He has been feeding regularly and has had no medical issues other than a mild upper respiratory infection a month earlier. However, the mother says, he doesn't seem to be as interactive as my other children were at this age. Physical examination reveals delayed developmental milestones and hypotonia. 2 years later, the child demonstrates involuntary movements and a tendency to aggressively bite his own lips and fingers. Laboratory analysis shows an elevated blood uric acid level. The enzyme phosphoribosyl pyrophosphate aminotransferase is most likely to exhibit increased activity in order to compensate for this patient's genetic defect. This patient has Lesch-Nyhan Syndrome, an X-linked recessive disorder characterized by progressive extrapyramidal signs, for example, dystonia, self-mutilation, and hyperuricemia in the first years of life. Lesch-Nyhan Syndrome is caused by a mutation in the gene encoding hypoxanthine-guanine phosphoribosyltransferase, an enzyme involved in the purine salvage pathway. In this energy-efficient recycling process, hypoxanthine-guanine phosphoribosyltransferase normally converts free purine bases, hypoxanthine and guanine, into purine nucleotides, inosine monophosphate IMP and guanosine monophosphate GMP, respectively. The absence of hypoxanthine-guanine phosphoribosyltransferase results in increased degradation of hypoxanthine and guanine bases into uric acid, causing hyperuricemia, and increases demand for de novo purine synthesis. The first step of purine synthesis is the formation of phosphoribosyl pyrophosphate. Although phosphoribosyl pyrophosphate can normally be utilized in the purine salvage pathway in conjunction with HGPRT, patients with Lesch-Nyhan Syndrome rely on PRPP function in de novo purine synthesis alone. In this pathway, PRPP is converted to phosphoribosylamine by PRPP aminotransferase, the activity of which must increase in Lesch-Nyhan Syndrome to supply adequate purine nucleotides for DNA synthesis and cellular metabolism. Aspartate carbamyl transferase, dihydroorotase, and thymidylate synthase are enzymes involved in pyrimidine, not purine, synthesis, and their activity does not change in Lesch-Nyhan Syndrome. Nucleotides are composed of purine or pyrimidine bases attached to a ribose sugar. The enzyme ribonucleotide reductase converts the ribose sugar to its deoxyribose form for use in DNA synthesis. Its activity is determined primarily by the cellular proliferation rate, for example. Increased cell division requires more deoxyribose nucleotides and is not affected in Lesch-Nyhan Syndrome. Lesch-Nyhan Syndrome, for example, dystonia, self-mutilation, hyperuricemia is caused by a mutation in the gene encoding hypoxanthine-guanine phosphoribosyltransferase, HGPRT. Reduced HGPRT activity leads to impaired purine salvage and increased de novo purine synthesis, process necessitating increased phosphoribosyl pyrophosphate aminotransferase activity.